Good morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery. My name is Dr. Stanley Aruyaru. When I shared the video on informed consent and the content, I got comments that I did not include the anesthesia consent, and that is true. I covered the content for surgery. The anesthesia consent was not included. Now, that is something that will come up in subsequent talks. But today, let us talk about the all-important question. Lakini daktari, nitasikia uchungu. This is a question I have heard countless times. And I know you watching, if you've gone through surgery, that was your worst fear. And I really hope that you did not have to experience pain. Our research shows that pain, the fear of pain, comes only second to the fear of death for patients going through surgery. And today we want to quickly talk about how we address pain during surgery. And I would like to introduce two concepts. One is a concept called anesthesia, and two is the concept called analgesia. What is anesthesia? Anesthesia is making sure that the patient is insensitive to pain. So sensitivity to pain is taken away, and sometimes even consciousness is taken away. So it is insensitivity to pain with or without loss of consciousness. That is anesthesia. That is what happens when surgery is going on. The second concept in addressing pain is what we call analgesia. Now, analgesia means insensitivity to pain only without losing the sensitivity to other things and without losing consciousness. That is to say that the pain is numbed, but the sensation of touch remains. You can feel, and you are fully conscious. Analgesia as a concept applies before and after surgery. Let's talk about anesthesia. Anesthesia is important so that the patient does not feel what is going on. And anesthesia can be categorized into three. You have general anesthesia, you have regional anesthesia, and you have local anesthesia. General anesthesia means that the patient is paralyzed, they can't move an inch, they can't flinch their muscles. It means pain is knocked off. It means they are made to forget whatever is happening. And that means that the person responsible for that general anesthesia has to breathe for the patient to keep the patient alive. Those are called components of general anesthesia. It is important that not only you do not feel pain, not only that your muscles are relaxed to allow surgery, that you actually also forget that experience, because the experience itself can be traumatic. What about regional anesthesia? Regional anesthesia is where a certain part of the body is numbed off, paralyzed, has no sensation as surgery is going on. For the ladies watching who have gone through cesarean section, for instance, you will remember you must have received some spinal anesthesia. So an injection is done into the back, and then from the navel downwards, there is no sensation at all. That is regional anesthesia. It doesn't need to be spinal alone. It can be a whole limb is paralyzed and the rest of the body is okay, and surgery can proceed. And finally, we have local anesthesia, where just one area is numbed off. Say you have surgery on the finger, the doctor can inject some medication around that area and the whole finger is insensate, and then surgery can proceed. Those forms of anesthesia take care of pain during surgery. What about after surgery? After surgery, now we go to the next phase, which is called analgesia. It means you're sensitive, you can eat, you can feel, you can itch, but you should not have pain. And for that, we introduce a very interesting concept called the step ladder in pain management. What that means is, depending on the degree of pain, and remember we've spoken about the complexity of surgeries, the various grades of surgery. Now, even the higher the grade of surgery, the more likelihood of requiring a lot of strong painkillers. Therefore, we grade the medication we give to control pain for patients who have gone through surgery in a stepwise approach called the WHO, or World Health Organization step ladder for pain management. Means if the pain is a little, you can just go on with some painkillers that you can swallow. Maybe start with Panadol, paracetamol. Maybe go to ibuprofen or brufen or others. And the medication in that category is varied depending on what the patient can tolerate. If you have ulcers, for instance, we might leave out medications that can cause ulcers. If you have another problem, we might leave out paracetamol, for instance. But that is the first tier, if the surgery was a little. The second tier is now to introduce a stronger category of painkillers. Some of them are called weak opioids. And now you hear doctors prescribing something to inject or something to swallow that is slightly stronger than what we've just described. And on top of that, they already have the first tier. So the aim is, the more you add on top, you don't withdraw what you started with. You keep adding them. And the extreme of that ladder, the highest level of that ladder, are the strongest painkillers you can get, some of which are controlled because they can easily cause addiction and they can easily be abused. For instance, pethidine, for instance, codeine, for instance, morphine. They are called opioids. And we have weak opioids and we have strong opioids. If you look at all that categorization of these painkillers, the surgeon assesses, and the anesthetist as well, assesses your pain score and guarantees that this is going to be where we will start and this is how we will escalate. And we take the reverse order as your wounds settle down and the pain goes down. Now, those medications, some of them can be given to swallow, others can be given by the drip, others can be injected on your muscle or under your skin, depending on which category and which route you're giving. No one should feel pain. No one should go through the inconvenience and agony of pain because they have gone through surgery. Again, there is no one suit fits all. Every person's requirements are categorized based on their pain threshold and based on their tolerance to the various medications we have for pain control. That is it about addressing pain. Feel free to ask your surgeon how they are going to handle your pain, and at that point quickly bring out any allergies you may have, because that contributes to the choice of drugs that is at our disposal when we are managing post-operative pain or pain after surgery.